Hey, Lonnie.
Welcome, everyone, to our second part of our first aid webinar series. This presentation is all about understanding procedures, so what needs to be included based on the new regulation. Additionally, we'll also chat about some industry best practices on how you can enhance your first aid procedures for when something critical does take place in your workplace. So before we get started, though, I'd like to acknowledge that I'm grateful to be joining you from my home office in Kelowna that's located on the traditional unceded territory of the Silk Okanagan people, including the West Bank First Nations and the Okanagan Indian Band, where I have the honor to live, work, and play. We would also like to acknowledge that the Go2HR office being located in Vancouver is on the unceded traditional territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations, and that our work across BC takes place on the traditional unceded territories of 203 distinct nations. We pay respect to these nations and are grateful to live, work, travel, and play on these lands and waters of BC's Indigenous peoples. To introduce ourselves today quickly without repeating ourselves from last week, Simi and I thought it would be really fun to add an interesting fact about our history within the health and safety from our past to keep things, a little bit fresh and new. So next week you'll get another fun fact. For those of you who don't know me or just tuning into our webinar series now, my name is Lonnie and I'm the industry health and safety specialist with Go2HR. I've been working in the tourism and hospitality industry in BC for 10 to 12 years, but originally I'm actually from the prairies where my family ran and still runs a grain farm. So I've been taught risk management from a very young age, helping out on the farm. So Simi, would you like to share your fun fact now?
Yeah, thanks, Lonnie. So I'm Simi, the other health and safety specialist, and I'm pretty new to the industry of tourism and hospitality. A year ago, I did an internship with an oil and gas company, where I flew out to Fort St. John's and I stayed in the oil field, learning about worksite management, from a safety perspective. So I thought that was super fun and a cool experience.
Yeah, that sounds like a lot of fun, actually. Maybe for us safety people. But yeah, for those again who may have missed last week, before we get into our topic of the day, we thought we'd give a brief overview of who Go2HR is. So we're both the health and safety and HR association that supports the tourism and hospitality industry in health and safety, HR, training, and research and strategy in order to drive strong workforces and safe workplaces that deliver world-class tourism and hospitality experiences in BC. So you can lean on us to assist you in understanding HR and HR health and safety regulation, as well as industry best practice, and to save you time, money, and effort in some of the behind the scenes aspects of running your businesses. So if you're not already familiar with us, check out go2hr.ca, where you'll find a variety of different resources and support available to make your lives easier. So last week we covered with Tim from WorkSafe an overview of the changes and how to conduct a first aid assessment. So if you weren't able to join us last week, highly suggest going back and watching that session. So lots of great questions were answered during that session in the Q&A period. There was an overwhelming number of questions about the assessment specifically. So in response to that, we're actually quite curious if you can give us some of your feedback here. Simi's going to load a poll here in a second, but our question to you is whether you'd be interested in a workshop specifically on how to do or how to fill out that assessment, going further into depth on, determining when to do multiple assessments, considerations for remote and less accessible workplaces, and exploring some more of those factors that are specific to our industry that can be considered for those second step of the assessment. So, identifying those risks and hazards unique to our CUs and our workplaces, the different types of injuries that we've previously seen, and some of those barriers to first aid. So thank you so much to those that have answered the poll. It'll be live there, so you can, yeah, I think in a little bit we can end the poll, but I'll just continue on in the interest of time here. Okay, so to get into our topic for today, as we mentioned before, there's some specific items that are called out in the new regulation that is required to be included in your first aid procedures. So we're going to delve into that and then show you how to best integrate those into your existing procedures. We're then going to talk about some industry best practices that can elevate and enhance your first aid programs. So hopefully you're familiar with some of those things, but if you'd like to go in more in depth on how to integrate some of those things and what that might look like for your specific operation, we encourage you to get into contact with us, and we can do that on a one-on-one basis. Lastly, we'll cover the resources and support that are available to you at no cost. In this webinar, though, we probably won't have much time, if any, at the end for the Q&A session or section. And so we encourage you to still submit your questions via the Q&A feature, and we'll follow up on them. So as a reminder, you can upvote questions that you'd like to see answered, and we'll ensure that that gets added to the Q&A that will be available online probably by Friday. Please try and make sure that your questions are easy to understand and that so that we are able to answer them best we can. Now I'm going to hand it over to Simi, who's going to chat to us, start us off about some of those new regulatory requirements.
Awesome. Thank you, Lonnie. So as we know, WorkSafe BC has come out with new regulations and guidelines on first aid. But before we delve into what these changes are, I wanted to kind of define the difference between regulations and guidelines, as they both play pretty important but different roles in us understanding and implementing these new requirements. So regulations are rules that must be followed by law, whereas guidelines are recommendations that provide advice on best practices. So basically, the regulation is the law, and the guidelines are there to help us understand and fulfill what is required in the regulation. So hopefully that clears some things up there. So in OHS regulation 3.17, it states that employers need to have a clear and up-to-date written procedures for providing first aid at the workplace. So these written procedures will need to include certain information, which is all explained in depth in the OHS guidelines. But we've also broken it down here into six distinct categories that we will cover in this section of our presentation. And so these six categories are the availability of first aid equipment, supplies, facilities, attendance and services, where first aid is located and how to call for it, how the first aid attendant should respond when help is needed, how to access and move injured workers if there are any barriers at your workplace, the first aid attendant's authority in treating injured workers, and if emergency transportation is needed, the method of that transportation. So we will dive into each one of these topics now, starting with number one. So looking at our equipment, supplies, facilities, and first aid attendants. So some workplaces may require multiple first aid attendants, and the purpose of multiple first aid attendants, oh, sorry there, Lonnie. One second. Sorry. The procedures should,
Yeah, you were just one slide ahead, so just the one you
yeah,
were
I
just
just,
talking about is right, I think.
yeah, no, I just recognized. I was like, wait a minute, that didn't sound
All
right
good.
from the slide.
Good.
Okay. So, sorry, your first aid procedure should include the names of your first aid attendants and certification levels, along with a quick overview of the first aid equipment and supplies available at your work site. So, it's a good idea to have a site map with the marked key locations of where those supplies or equipment and your first aid facilities are located. So let's say, for example, if you have three intermediate first aid kits on site, you would note down in your procedures, um, like where, so you would note down the supplies, but also the location of those kits. So, for example, if they're located at the front desk or around maybe in the staff area, lunchroom, the same thing goes for equipment such as AED. So you'd want to list that in your procedure and then just also make that location known. And some workplaces may require multiple first aid attendants. So this is what I was talking about earlier. The purpose of multiple first aid attendant is to ensure adequate response to major incidents, and it should ensure adequate first aid coverage. So when you do have multiple first aid attendants present, there are specific key considerations that should be incorporated in your written procedures. So If on your first aid assessment, your minimum level of first aid results require multiple first aid attendants. So for example, on this table on this slide, the example here is a class 3 workplace like a ski resort that is both remote and less accessible, which has a moderate hazard rating and has about 20 to 49 workers. So according to this table, you're required to have multiple first aid attendants at different levels. A side note to mention here is that in this case, it says that just because it says you need one basic first aid attendant and one advanced first aid attendant, that doesn't mean you can't increase from the minimum requirement to have two advanced first aid attendants. So just because that's what it computes in your assessment, you can always go above and beyond and offer more, but you just can't go any less than what that assessment calculates. However, back to the main point of having multiple first aid attendants at one location, there are a few key considerations that should be incorporated into the written procedures. So, for example, in workplaces where first aid attendants have different levels of certification, the procedures should state that the designated attendant with the higher certification should be the lead attendant for serious incidents and serious injuries. When looking at minor injuries, any first aid attendant can provide care and complete required documentation like first aid records. However, the lower level attendant should consult with the higher level attendant just to ensure that the higher level attendant doesn't have any additional treatment suggestions for the injured worker before that worker returns to work or is transported to medical aid. Secondly, for work locations that have multiple attendants with the same level of certification, procedures should include instructions on how to determine which attendant will be the lead attendant for major events, serious incidents, or serious injuries. For example, supervisors or managers as the first aid attendant, senior first aid attendants who are returning for their second, third, or fourth season, or someone with higher level of first aid outside of the workplace. Thirdly, where a workplace has multiple first aid attendants, procedures should identify how attendants are to respond. For example, attendants working and responding on different floors of a building. For major events, serious incidents, and serious injuries, all designated attendants should respond, or the employer should provide alternative procedures and measures to ensure that sufficient attendance are able to respond and provide that optimal first aid treatment to injured workers. And lastly, according to OHS Regulation 3.21, which explains the first aid attendant responsibility, once that care is initiated, an attendant cannot hand off the care to another attendant with a lower level of certification. So higher level of care, yes, absolutely, that's fine, but lower level, no. So we understand that a lot of special considerations for those workplaces with multiple first aid attendants. So if you missed one of the considerations, don't worry. This is all going to be explained in the resources where we're going to send those out by the end of next week, I believe.
Perfect. Thanks, Emmy. Yeah, that was a lot of super specific information for those remote and or for those workplaces that have multiple first aid attendants. So yeah, get in touch if you have questions on that specifically. So our second requirement is when it comes to first aid location and contact. So the written first aid procedures should instruct workers on how to obtain the first aid for both minor and serious injuries, especially if the procedure slightly differs. And for example, a minor injury might be a small cut in the kitchen that can be treated with basic first aid, while major injuries could be a server tripping on a wet floor and sustaining a more serious injury like an injured back or broken wrist or something like that. This will make more sense when I show you my example on the next slide, so stay tuned for that. Procedures should also provide instructions on the expected response times for first aid attendants when it may be necessary to either transport the injured worker or request emergency services. So in the case of a serious injury, written into your procedures should be guidance to first aid attendants on when to initiate transportation or emergency services to assist in providing that initial first aid. It's imperative for workers to understand where first aid equipment and supplies are located. So some of the smaller restaurants, hotels, campgrounds, You may not be required to have a first aid room, but you can consider where you would like injured workers to go if they need help. So a staff-only area that can be closed to guests and other workers is a great location for your first aid kit. Communicating your procedures where workers can find the first aid supplies and equipment is another requirement for the new regulation, and we'll go over an example here in a second. So now going beyond the written procedures in order to fulfill that communication of the procedures and location of supplies to workers, consider having signs or maps posted around your workplace. So maybe on your safety notice board, that's a great place for it, indicating the location of the first aid equipment, supplies, or facilities, so there's little delay in contacting first aid. So additionally, consider the use of all methods for contacting first aid attendants, which could include whistles, sirens, lights, radios, local phones or cell phones, anything that ensures the attendant can hear or see the alert and know where to respond to. So communication is key in emergency response. If you do a lot of incident investigations, you can see that a breakdown is usually happens in the communication first. So let's check out our example here for how we would include this in our first aid procedures. So as you can see, I've listed the instructions to all workers on how to summon first aid, including walking into the first aid room to see a first aid attendant. This is easier for workplaces that have like a dedicated first aid person who mans certain stations, like a ski resort with a first aid hut or first aid room. And then also listed there are 2 ways for contacting what I've called dispatch. Replace that word dispatch with whatever terminology you'd like. So maybe at your hotel, it's the front desk attendant or duty manager that dispatches the first aid attendant when on duty. So what I will say though, is that it's always smart to have a centralized location or phone number or radio number where the workers can call for help. If they're consistently having to remember who's on shift for the first aid attendant or who they need to call now, today versus tomorrow, there's a chance that in a panic they won't remember who to call. So this also helps with initiating the proper reporting to supervisors and managers of the injured worker, along with the paperwork being initiated as well. So this way, any workplace incident, regardless of whether it's minor or major, gets reported and hopefully followed up on appropriately. Additionally, I've included here guidance for workers to assess their injury for whether they can walk into the first aid room or whether they should wait and get first aid to come to them. And then lastly, at the bottom of the example box there, you can see that I've given some guidance for the response time threshold of 10 minutes. So it's written into the regulatory requirements that if a first aid attendant should be able to be on scene with an injured worker within 10 minutes. But if my first aid attendant cannot be on scene for some unforeseen circumstance, I've given guidance of when emergency services should be initiated. It's that 10-minute mark. Lastly, on the right-hand side, you'll see a map of where the first aid supplies and equipment live within the first aid room. So a visual aid of a photo like this could be included in your procedures to help workers reading the procedures to remember where the first aid supplies are and where the equipment lives. It doesn't have to be a cool, computer generated one like this. A simple photo taken from your first aid room where you house your first aid supplies and equipment, label the photo, and attach it to your procedures document. Back over to you, Simi.
Perfect. Thank you, Lonnie. So now we're going to look at first aid attendant response. So this one is quite simple. In most workplaces, first aid attendants often take on other roles alongside their first aid duties. So it's important to have a plan in place if they need to step away from their regular tasks to provide first aid. So, for example, if the first aid attendant is working at the front desk and they get a call about a kitchen accident, your first aid procedure should provide guidance for them to hand off their responsibilities reasonably quickly, like calling another staff member to cover the desk so they can respond right away. Some job duties don't allow for you to drop everything and respond to an emergency. So consider what are appropriate jobs for first aid attendants to have if they're not specifically designated first aid attendants. So for example, a lift operator at a ski hill cannot abandon their post unless someone is there to take over. Similarly, a head chef cannot abandon the kitchen to attend to an injury without a restaurant full of people getting hangry. So consider other roles for first aid attendants. An example or two of a good job for a first aid attendant would be a concierge or a bell person, potentially a groundskeeper or a maintenance worker. So that depends on your operation. Sometimes they're able to drop their tasks and respond, or a supervisor or manager who doesn't have a specific station they're tied to during their shift. In my example on the left-hand side, you can see that there's some guidance and priority to first aid calls. So this is maybe something that you might have written down in your procedures. So just looking at that example there, so managing regular duties while responding to a first aid call. So first aid attendants are regular workers with an extra duty of providing first aid to injured workers. When responding to a first aid call, the first aid attendant is responsible for contacting their direct supervisor or manager to initiate coverage for their regular tasks, and responding to an injured worker takes priority over all other duties. So maybe that's some inspiration for you guys there when you build out your first aid procedures.
Inspiration, I like it. Okay, we're moving on to the fourth thing that needs to be included. Oh, this is also you. Go
Yeah, it's
ahead.
still me.
Sorry.
So, I mean, this one is also quite simple. So giving you a bit of a breather before we tackle barriers to first aid and transportation, as those ones can definitely be a bit more complicated. So first aid procedures should clearly state that the first aid attendants have the authority and are in charge of determining next steps for the injured worker. For example, that next step may be that the injured worker being passed into the care of paramedics or discharged from the first aid room to be transported to medical aid, like a walk-in clinic or a hospital. Or in the case of multiple first aid attendants, workplaces that we talked about earlier, where an attendant with the same or higher level of first aid certification takes over. In the case of minor injuries, this next step may simply be that the worker is okay to return to regular or modified duties. It's also important to note that workers also always have the right to refuse treatment from a first aid attendant, but they may still need to attend further care like a clinic or emergency room. However, cases where first aid is refused, it's quite rare, but it should be investigated for further understanding of why that care was refused, because there may be a problem with your procedures that need to be rectified. A first aid attendant decisions also must not be overruled by supervisors. So this includes decisions about whether a worker needs to be transported to the hospital, how they should get there, and if the attendant should accompany the injured worker during transport. So that being said, in good return to work programs, which we will talk about in a little bit more detail later, the first aid attendant, injured worker, and the injured worker supervisor or manager work together to determine if there is suitable work available for the worker based on their functional abilities. When we go into the next slide here, you're going to see an example of what you can consider adding to your first aid procedures in regard to first aid attendant authority. Okay, so looking at this example, so firstly, we have a statement about first aid attendant holding the authority for determining care and the transportation decisions. So it lists out the requirements of the supervisors and managers not overruling that decision. In the second bullet point there, you can see that it's clearly stated that workers have the right to refuse treatment, but may still be required to seek further assessment on a case-by-case basis to ensure they're fit for returning to their duties. And in the last bullet point there, the requirement of both the duty to cooperate for workers and the employer are called out, where the injured worker, their supervisor, and the first aid attendant will work together to determine potential suitable work for minor stay-at-work injuries, and a reference to the OHS program manual where more information on the injury management program is located. Back to you, Lonnie.
Beautiful. Now we get to move on to some of the harder topics when we're talking about managing barriers to first aid. So, if some parts of your workplace aren't easily accessible for BC Ambulance, such as confined space or isolated parts of your resort or something like that, first aid procedures should outline what equipment, for example, backboards and basket stretchers, and what personnel are needed to help move an injured worker to a spot where BC Ambulance can assess and treat the patient. So, for workplaces that have separate rescue procedures for harder to reach areas, for instance, fallen worker rescue procedures or confined space rescue procedures, your first aid procedures can simply reference those rescue procedures. There's no need to rewrite procedures in more than one place. It is worth noting here and making a specific distinction. So a lot of times in ski resorts, for example, we use the word or the term transport when we're talking about relocating an injured worker, for example, from the place of injury, whether that be on the slopes or down in the maintenance shop, to the first aid hut. Okay. Don't let that confuse you between transportation on site versus transportation from your base area to medical aid, so to the hospital potentially. So if you want to continue using the term transportation for that on-site transportation, you may consider implementing essentially a two-stage transportation plan. So stage one would be to relocate them on-site to an accessible area, so AKA managing the barriers to first aid. And then secondly, implementing that transportation to medical aid. So sometimes that includes an ETV, depending on whether or not you're deemed remote. So keep that in mind. I don't want to go into too much depth here as the room is filled with a variety of types of employers. So if you have specific questions about your transportation, both on-site and how it differs from transportation to medical aid, please get in touch. That's something that we would actually also include in those first aid assessment workshops, because we would talk about those barriers to first aid as well. So keep that in mind if you want to come to one of those sessions. We'll probably talk about that. Also note that during your first aid assessment, if your workplace was deemed not remote, these transportation to medical aid or that second stage of transportation of the transportation plan that I mentioned are probably not necessary. You probably don't need an ETV. If it's not called out in that Schedule 3A, you don't need an ETV, you don't need transportation to medical aid. You still need to manage those barriers to first aid on site. So transporting a worker from a more isolated area to the first aid station, for example. But yeah, let's bring it to life with an example here. Okay, so you can see that I've called out a few different things on this example. So we got the relocation of injured workers on site. Okay, the workplace, this workplace, I don't know what type of workplace this is. It's got ski slopes, it's got confined space, and it's got a dock or a wharf. Okay, that's that working on or over water. Okay, so we have 3 less accessible areas where injured workers would need rescue services. So for instance, in our first example here, we have the first aid attendants, and then it calls out 2 first aid attendants needed, are to relocate the injured worker using a patient toboggan from the slope, the ski slope, to the first aid room located on the east side of the parking lot. So it calls out also the additional supplies and equipment based on the injury that might be used. It talks about the mode of transportation. So either that's being the toboggan being pulled by a snowmobile or manually by skiing with a tail gunner. Okay. Our second example is the dock or the wharf. So first aid attendants, between 2 and 6 needed. These are just examples, okay? I've just picked these numbers that you would have to determine what's needed for your specific workplace and your specific less accessible area. So yeah, dock and wharf, first aid attendants, apparent up to 6 can be needed, are to relocate the injured worker using applicable first aid supplies and equipment such as backboards, splints, etc., from the dock to the first aid room located on the east side of the parking lot. Additional supplies and equipment are called out as well, and then that mode of transportation, either by a rolling gurney or manually carrying the stretcher. That's probably where you need the 6 people at least, right? Depending on how far they're transporting the person to. And then in that third example there, confined spaces. Now, we have a fully confined space rescue plan on site at our job, so we don't need to reiterate everything in the first aid procedures. I just make reference to the confined space rescue plan, and that's where people can get information for how to relocate injured workers on site. So that'll probably, yeah, there's a lot of things that go into a confined space rescue plan. It won't open that can of worms right now. Okay, so that's managing barriers to first aid. And then the next thing we're going to talk about here is transportation methods. So we've previously established, obviously, that the first aid attendants hold that authority and are trained to determine when a worker should be referred to medical aid. So for this section of your first aid procedures, transportation considerations for both a stable and unstable patient should be included. So that means how to transport a worker to the hospital or clinic if they can walk or they're ambulatory, or their condition is stable and non-life threatening. And then also you have to list out how to transport an injured worker if they can't walk or if their condition is unstable or life-threatening. So following those rapid transport guidelines. Transportation options might include, a worker's family friend, that the emergency contact coming, picking them up and taking them to medical aid, sending them in a taxi, an Uber, a coworker can drive them down in a properly insured and maintained vehicle. So employers are responsible for making sure that the worker is transported safely and without delay, and they need to show that they've taken due diligence in the process by including specifics such as who's responsible for arranging the transportation for the injured worker, directions to the nearest hospital or non-emergency medical treatment facility, instructions for any equipment or procedures that may be needed to safely move an injured worker to an area accessible by BC ambulance, the location of emergency transport vehicles if on site, and then who will communicate with the worker's emergency contact and what specific information is going to be shared. Okay, so that's quite a bit that needs to be included in those transportation methods. So let's look at an example. Okay, so we got quite a few things here. My example goes from this page onto the next, so stay with me. First, we call out who's responsible for transporting the worker. The employer is responsible for transporting the worker. That doesn't mean that they must drive them down. That means, or drive them to the medical aid area, like the hospital or clinic. That just means they're responsible for arranging it, making sure that they get there. So once they arrive, like say they do go back with their emergency contact, maybe having a follow-up procedure of, yes, I've made it to the clinic. Okay, yes, I've, they can have that a bit of communication there. Now, based on whether the worker is stable or unstable, the following methods of transportation might be considered. So first, I call out a stable patient and how they could be transported. So personal emergency contact, friend, family, in a personal vehicle, transit, taxi, rideshare, these are all stable, right? Like it's pretty minor injuries. Like if it's a wrist injury, I can sit in a personal vehicle and go to medical aid. You can also send them in a company vehicle by a trained worker in designated transport vehicle. So whether that's an ETV that you have on site or just a regular workplace company vehicle. And then again, where it's located on that east side of the parking lot, okay? When we talk about an unstable patient, though, there's only very specific means of transport, right? A certified ETV that meets all of the requirements set out in Schedule 3A, driven by a trained worker located in the east side of the parking lot. And there's very specific requirements for ETVs. So check that out if you have an ETV requirement in your assessment results. And then ambulance or air ambulance, obviously, if we've initiated through 911. Some additional notes for transportation, though, I've listed in our procedures here. Moving or repositioning the patient, especially unstable patients while in transit, may only be done by the direction of the first aid attendant. They're the ones that are trained in transportation, whether it's a transportation endorsement or a full-on 80-hour course. So you can add more detail there if necessary, but I didn't want to, clog up this slide with a bunch of information. So if you want more information on that, or you want me to figure something out with you, contact us directly. I've also listed the directions to the nearest hospital, Vancouver General. I've just picked an example. And then dispatch, direct supervisor, and HR representative share the responsibility to ensure that the injured worker's emergency contact is notified of injury and transportation to medical aid. So that's, again, calling out whose responsibility it is to get in touch with that worker's emergency contact and let them know that they've been transported because of an injury. Simi, over to you.
Thank you, Lonnie. That was a lot. So hopefully you can have a breather now.
Yeah.
Yeah, so moving into additional considerations. So yeah, there are additional considerations that are called out in the guidelines provided by WorkSafe BC that are somewhat logistical, but should be seriously considered when developing your first aid procedures. Some of which are already requirements in different sections, such as reporting injuries to WorkSafe BC through the claims and prevention divisions, as well as maintaining your first aid program by ensuring adequate coverage, first aid attendance, troubleshooting any unplanned absences, tracking and scheduling first aid recertifications based on their expiry date, regularly inspecting and maintaining both first aid supplies and equipment, and as well as your emergency transportation vehicle if that's a requirement at your specific location. It's also important for all workers to understand the company's first aid procedures, and they should be able to access them easily in the case of an emergency. So ideally, these procedures should be printed out and posted around the workplace. There are various ways to make sure that workers can quickly find these first aid procedures. For example, if you have workers that are able to use their cell phones on site, you can provide access to review the procedure through a QR code, a website, an app, or any mobile-friendly platform. For office-based workers, yeah, to make sure that those procedures are easy to find. Maybe you can have them available on the internet or a shared drive. For mobile workers, it's a good idea to keep first aid procedures in vehicles and include them on vehicle checklists or inspections, including copies of first aid procedures and first aid kits or with other supplies. It's also not a bad idea. And it's also a good idea to ask workers which communication methods work the best for them. And lastly, WorkSafe BC calls out for first aid procedures to be inclusive for all workers. So you as the employer are responsible for ensuring that all workers are treated with respect and without discrimination, including both of those who are seeking first aid and those providing first aid services. So training your first aid attendants and other workers in the principles and practices of equity, diversity, and inclusion, also known as EDI, and integrating these principles into your first aid program can really enhance the effectiveness and inclusivity of the program. Some examples of how EDI principles may be considered when developing or enhancing a first aid program include considerations when providing equipment. So ensure that the equipment is available, especially personal protective equipment. You want to make sure that that is suitable for workers of various sizes. For example, first aid kits often come with large sized gloves, which may not fit all first aid attendants. Secondly, in accessibility, ensure that any signage and written procedures are provided in languages that are accessible to your workforce. So develop a process to kind of bridge language gaps or other barriers between first aid attendants and the workers that they may be called to treat. And lastly, worker engagement. So there should be a process in place to routinely gather feedback from all your workers in order to make enhancements to the first aid program accordingly. Now, again, these items are only called out in the guidelines. Though reporting injuries and maintaining your program are requirements of other sections of the regulation. So I would start with the previously mentioned six mandatory considerations before enhancing your program with some of these additional aspects that I just covered.
Beautiful. Okay, everyone take a deep breath. Ah, nice. We've concluded the regulatory requirements, what needs to be included in the updates. So now we get to talk about some of the industry best practices. We've got a few different topics to chat about with you, and the first being worker versus guest first aid. So in tourism and hospitality workplaces such as hotels, restaurants, ski hills, golf courses, campgrounds, we may be responsible for guest first aid, just like we're responsible for worker first aid. And though we at Go2HR are not experts in what level of care or what paperwork needs to be filled out when it comes to guest first aid, we did want to chat about it for a little bit because there are some ways in which worker and guest first aid are similar, and then ways where they differ, and we want you to consider those items. Okay, so for instance, worker and guest first aid are similar in the fact that there is that duty of care present. So not only because we care about our guests, but also because it may be a requirement based on general liability to manage those incidents properly. That duty of care to provide first aid is there. So similarly, we may have to relocate patients on site in order for the ambulance personnel to be able to reach them. Remove, we might need to remove them from the ski hill, from, one of the back side of our mountains, or from, for instance, the 16th hole of a golf course to the first aid room or parking lot. There's also a few differences that are worth mentioning, though, that I've seen make a difference in my previous roles. So the documentation may be different. You might still have to do a first aid record. It might be the same form, it might be a different form. That's up to you, but you won't have to do as much for an incident investigation, reports that need to be sent to WorkSafe, obviously. You don't have to do for a guest injury, but you have to do for a workplace injury claim. With guest first aid, you might be required to do an investigation, but it's most likely would look at least a little bit different than your workplace incident investigation reports. Secondly, your transportation option may be different. So if you're a heli ski operation and you need to evacuate someone from the backcountry, a helicopter is a helicopter. However, if I'm looking into transporting injured guests from my workplace to medical aid, the best option would either be their personal car, obviously if their condition is stable, or an ambulance, so if they're unstable. I would definitely hesitate to send an injured guest in a company vehicle, as it may be opening you up to more exposure for potential negligence or liability. Okay. And lastly, the injury management and follow-up. So it's always a good idea to call a guest to show you care and check in on them, maybe a week later or so, depending on their injury. But the injury management program and follow-up that you're going to do with an injured worker is going to be a lot different than what you would do for a guest. So I say all of these with really one main message in mind: to ensure your first aid attendants know the different protocols between guest and worker injuries. I've seen it previously where first aid attendants would tell every single guest that came in, to go get checked out by a doctor. And so in turn, they told every worker to go get checked out by a doctor as well, even if the injury was very minor and could be easily managed at the workplace. Yes, the first aid attendants have the authority to send workers to medical aid. However, we as the employers can educate the first aid attendant on the injury management program and the return to work options that are available, so that they have the best knowledge that they have, in order to ensure workers get the best treatment for their specific injury. And sometimes that's simply avoiding a certain task for a few days, allowing some inflammation and soreness to subside, and then returning to regular duties. So making sure that your first aid attendant knows what's available in your injury management and your return to work program is key for that. Now, that being said, let's chat about workplace injury management. Simi's going to walk us through that.
Awesome. Thanks, Lonnie. Okay, looking at workplace injury management. So, So combining your first aid procedures into your return to work process is an important way to bridge the gap between the two programs. So ensuring that first aid attendants understand what alternative or modified duties are available, depending on what the injury is an important way to start managing some of those minor injuries in-house, rather than just sending them directly to medical aid and then them getting unnecessary time away from work to recover. An effective injury management program can have numerous benefits to both the workers and the workplace. As we all know, the longer someone is away from work, the harder it can be for them to return back to their original role. So that's why it's important to support their recovery and work together to bring them back when it's safe to do so. So by doing this, you're not only keeping the worker engaged and earning an income, but they can also continue to contribute to the team. Plus, it helps keeps your compensation costs down. So just remember, timing is everything. Bringing someone back too early can increase the risk of re-injury. So it's key to make sure that they're ready before they're able to return. There are a few different pathways for a safe and supportive return to work, depending on each worker's situation. So the first one is stay at work. So that's when a worker stays on the job while managing their injury. There might be minor adjustments to their job duties, so they're able to perform most of their regular duties. The second one is recovery at work with modified duties. So in this pathway, a worker is given more meaningful modified duties, or what WorkSafeBC likes to call suitable work, to help them recover while still being active and engaged in the workplace. A third one is return to work after some time off. So this is for workers who needed some time off to recover before they are able to come back. Once they're ready, they can return either to their regular job or with modifications. That all depends on where they're at with their progress in their injury. And each of these pathways helps to keep the worker connected to the workplace while ensuring their recovery happens at the right pace, and are available for your workplace to integrate into your injury management program, depending on the needs of each injury. It's also important to acknowledge that injured workers may experience psychological impacts post-injury, and therefore it's important to provide support to your injured workers to ensure a speedy physical and psychological recovery. And there are various ways in which you can support your employees. So you can connect the worker with supports like the Employees Assistance Program, checking in frequently with the worker to see how they're doing, and including workers in meetings and updates to their return to work plans. So keeping them in the loop. We have developed some employer resources on how to provide psychological support to workers post injuries. So we'll be sure to also send that out after this webinar.
Perfect. That leads me into talking about managing critical incidences. So, workplace injuries can be quite traumatic for workers involved, especially for serious injuries. So, you can imagine if one worker is seriously injured in the workplace, they're not the only ones affected by the injury or by the incident. You have others on site that might be witnesses to their peer or their coworker getting injured or affected by proxy. So, for example, a worker who does the same tasks and has the perspective of that could have been me, or I was just working with that person yesterday. Additionally, you have the first aid attendants who are on site who may have responded to the serious injury of one of their peers and coworkers. Therefore, managing critical incident stress for first aid attendants and others affected by serious workplace injuries is imperative to limit the effect that the incident has on your overall workplace. There are multiple things that you can proactively do to essentially enhance your first aid procedures. So firstly, I'd like to talk about some of those in-house supports. So like Simi said earlier, providing that EAP, the Employee Assistance Program, and free counseling services is a way to do that. So if you're able to proactively put together a one pager that's ready to go and you can hand that out post incident, that's a great thing to do proactively. You can equip your leaders on how to have some of those hard conversations post-incident and potentially complete a CISM or CIR safety talk, which we'll get into those programs a little bit later. You can see them on the screen there. All of those ways are proactive ways that you can put together some supports in-house for a critical incident, so you can provide some support to workers, to supervisors, through that HR support potentially, through that EAP, free counseling option, um, just to help manage the impact of that critical incident on your overall workplace. So the next thing I'd like to talk to you about is critical incident response. And there's two programs that I'm going to cover here. And depending on your industry or sector, you'll be able to fall into one of these two categories for response. But again, there are things that you can do proactively to make these programs known and known to first aid attendants and others in your workplace. So the first one is the Mountain CISM program, or the Critical Incident Stress Management program. Mountain CISM is a program developed by the mountain community, including 3 mountain industry associations for the mountain community or the mountain industry. So the goal of the program is to assist in preventing long-term psychological harm by having trained peer responders lead sessions immediately after an incident. Those are either one-on-one support sessions or group debriefs, which allow for a supportive, safe environment for those affected to talk about their experience, the role that they played, what feelings they have, and what reactions they have without shame or blame. CISM can help workers diffuse highly charged emotional situations, return them to full productivity, and improve mental health and increase morale. This program, Mountain CISM specifically, is going on its 3rd year of activation, and it's assisted more than 200 individuals through one-on-one and group debriefs. So it's worth noting that this program essentially is providing psychological first aid, for lack of a better term, and connects those who need further, more professional support with the support that they need. So it would be like going to first aid for a physical injury, getting treated, and depending on the severity of your injury, getting either patched up and you returning to work, or being sent to medical aid for further assessment or treatment. Secondly, WorkSafe BC's Critical Incident Response Program is available. So similarly to Mountain CISM, but available across sectors and all industries, WorkSafe has a CIR program that assists in reducing any distress to workers after a critical incident. The program provides support and education to workers affected by critical incidents in the workplace by a mental health professional, helping them to process their experiences and their emotional responses. We're going to hop over to some of the resources and support available now, which we will provide links to, obviously, post-webinar. But back over to you, Simi.
Thank you, Lonnie. Yeah, so we have some resources and support that I'd like to share that can help you as you work on developing your first aid procedures.
Oh, sorry, one
Yeah,
second.
no worries.
There you go.
So we have some online resources that can help guide you as you start working on updating your first aid procedures. They are linked on the slide, and you'll be able to access them when we send out a copy of this presentation following the webinar. And next slide, Lonnie, please.
There you go.
Thank you. And yeah, if you're looking for support or wanted us to go over your first aid procedures, please don't hesitate to reach out using our email, which will drop in the chat, or our contact form to schedule a first aid consultation. We're always here to help.
Yeah, just one thing to add to that too. I've put on here psychological health and safety consultations, just as a specific call out as well. So for any of those critical incident stress management response programs, putting into place some of those more safety talks or in-house supports from that psychological side. Our psychological health and safety consultants are definitely here, ready, and willing to help you on a one-on-one basis implement some of those in your workplace. So if you'd like to get in touch with them or have just even a conversation about it, you can use that contact us form as well, which is that QR code, I do believe, as well. Okay, lastly, we have some questions actually in the Q&A that are quite good. I think we can talk about them. I'll just read out the first one and answer it. Is the return to work plan a requirement or just a guideline? So there has been as of January 1st, 2024, more requirement to have that return to work program. So it's called Bill 41, and there's a duty to maintain employment and a duty to cooperate, and they're a little bit different. Duty to cooperate applies to all employers everywhere. Duty to maintain employment, there's specific employer and worker criteria that you have to fall under in order to have the duty to maintain that injured worker's employment. So yes, that is an actual requirement. We can go into that at another time, but we did do a webinar that's also listed on our website. Maybe we can include that link in some of the resources when we send it out, just so that you can see that requirement. And that Bill 41 webinar would be a good resource for you for that one. Okay, what else do we got in here?
Maybe the first one there, like I'm curious when we make a guide for how first aid attendants should respond to calls for workers, should they also have one for how they respond to patrons? So I
Mm,
guess.
yeah, that's actually a good point to talk about. At a previous employer that I was at, we had a bit of like a flow chart of like, okay, an injured person comes in. Are they a worker? Follow this chart. Are they a guest? They follow this chart. And so then they're able to determine, okay, what needs to be done for each person depending on who they are. So patrons, guests versus workers, and what that determination is, and what steps you go through with depending on who that person is. So yeah, that's definitely something that you can build out for your own workplace for sure. I would highly suggest it. Yeah, that's a great idea.
Awesome. Does WorkSafe BC offer their CIR program to injured workers?
That's a good question. I think yes. Critical incident response, a lot of times it has the view of people around the incident. I assume that it would be available for injured workers as well, because they are essentially impacted by the incident itself. So I wouldn't see why not. They do have, as part of claims, psychological support. So if you look at claims data from the last couple of years, they continue to add psychological assistance into those claims. So that's in assistance to their recovery rather than in the critical incident category. So there is support in both ways, but I would think that the psychological support within their claim would be more direct and like impactful than the CIR program to the injured worker specifically.
Awesome. Um, for advanced first aid attendant, is there a special training course that they have to take?
Yes, so that's an 80-hour course. In the new regulation, it has to meet a CSA standard as well. Lots of first aid training providers in BC are moving to this new training because OFA 1, 2, and 3 are being discontinued. Training providers have to be approved by WorkSafe BC. So it's important that you check out that list of approved training providers and making sure that you use one of them. It's going to be consistently being added to, especially before November 1st. So yeah, check that if you're hiring new first aid attendants or recertifying first aid attendants. I think we have
Awesome.
time for one more question.
Yeah, and this is a pretty good one, I think. So when
Okay.
first aid attendants respond to workplace emergency, are they protected and supported by WorkSafe BC or maybe a different company? And is there any legal repercussions?
I assume that's if their, first aid causes more harm than good, I think. Is that how you read it, Simi?
That's kind of how I read it as well. Yeah.
Yeah. I don't know the answer to that. We'll have to follow up on that
Yeah, it's an
and get
interesting
back to
one
you.
for sure.
Yeah.
Yeah.
So stay tuned in our question and answer resource, and we'll get back to you on that one. Our last slide here, we're going to end right on time. It's going to be great.
Mhm.
Maybe. Yeah, perfect. Is what's next. Okay. So before November 1st, remember that implementation date of November 1st, you'll want to update your first aid procedures. If you need some first aid consultation, or if you'd like us to review your procedure that you've written, please request a first aid consultation. We'll happily review your first aid procedure for you, give you some tips of what to include, of what not to include, etc. And then our next webinar is next Wednesday. It's the last installment, our third installment of our webinar series. And we're going to talk all about drills and staff training. So happy to answer any questions through safety@go2hr.ca, through the contact form, which is that QR code up here on the screen. Yeah, that's it for today. So thank you, everyone. I look forward to seeing you next week. And don't forget about the November 1st implementation deadline.